We are joined by Dr. Giridhar Babu, epidemiologist with the Public Health Foundation of India. He is also a member of the Technical Experts Committee to the Government of Karnataka to fight the COVID-19 virus. Dr. Giridhar Babu, thank you very much for joining us. My first question to you is, a lockdown is imposed to basically curb the spread of the virus. Could you tell us really how a lockdown really helps?
Now, there has been considerable debate on what is the use of a lockdown, and most common perception out there is that a lockdown will somehow make the disease disappear. So definitely, this misconception was initially dissolved because the initial set of questions were even after lockdown, why there is so many rise in cases. So let's revise our basics. A lockdown, what we call as mitigation measure, is most important to reduce the speed of transmission. So that's the main aim. Along with that, it will give enough time for the health system to respond in terms of arrange the beds, arrange the other logistics, see what kind of oxygen supply, medicines, and whether what kind of mechanisms you want to put in place for identifying those who require beds with special requirements. So these things are assumed that the governments will do when a lockdown is done. So whereas the first part of reducing the speed is visible immediately, the second part, which is preparation, will be visible only when the surge in cases occur. So, and the surge in cases occurs at different points of time. So therefore, only when the surge occurs, you would know whether they had prepared well or not. There's no other way of knowing how well the state is prepared.
Okay. So in some ways, Karnataka is following Tamil Nadu's example. Tamil Nadu was the first state, perhaps in the south, to impose a statewide lockdown soon after the national lockdown got over. So, I mean, did it really help Tamil Nadu? Tamil Nadu has had 2 lockdowns.
So, at least from whatever the data is available in the public domain, I'm not in a position to explain clearly whether the lockdown has helped Tamil Nadu. But whatever I could see is the case fatality proportion is decreasing, which means the acute burden of managing their complications is going down. However, the death per million is still a concern and it is rising. And also the infection is finding its source in some of the difficult areas beyond Chennai, whether it is Madurai or others, which are also crowded cities. So wherever there are crowd-like situations, closed populations in a very dense setting, that's where the virus will go in search of. So therefore, that's still a concern. So whether lockdown was useful in Chennai definitively or not, that we don't know yet. However, they had to do that to probably contain the speed. So in their case, they wanted to alter in terms of alternate lockdown and containment strategy, which is their strategy. There's nothing wrong with it.
Okay. During this lockdown, what is it that you expect the Karnataka government to do?
So, as I said before, the state governments are pursuing lockdown for different purposes. So for Chennai, it is to contain probably the speed when the surge was probably uncontrollable. But for Karnataka, it's mainly, I think, from the perspective of making sure that the mechanisms of coordinations are ironed out. Especially, they wanted to get an app for real-time distribution of beds. I also expect them to do much better in terms of getting more ambulances, recruiting some manpower for some of these health centers, which they are doing interviewing now, and also in terms of establishing mechanisms of compliance by the private health institutions. So all these things required some time, but before they could test it out, the surge in cases occurred. So probably this will give them another opportunity.
Yeah. But do you think both you and I think, if I'm not mistaken, Professor V. Ravi of the Neurovirology Department of NIMHANS, both of you are on the same committee, and both of you, I think, had recommended that the minimum lockdown should be of about 3 weeks. But do you think this 1 week lockdown is really going to help Karnataka?
Absolutely. So both of us, and we have got support from others as well. So most experts agree that when you want to implement a lockdown, it has to be minimum for two incubation periods, which is around 14 into 2 is 28 days, or at least three incubations period. So 28 days is also almost 4 weeks. So at least anything to do with between 3 to 4 weeks might be what most people would agree to reduce the speed of transmission. But as I said before, the goal of Karnataka state is not to reduce the speed. So we were recommending 3 weeks because we wanted to see whether these systems that they want to put in place, they run well or not. We need to pilot it out. We need to see what the real problems in the mechanisms are, and then make sure that they'll be all right. So that's the reason we were hoping at least 2 to 3 weeks might be necessary. However, if the government thinks all of that can be done within a week, we'll be very happy.
But you think you can set right, you can clear the backlog of 35,000 tests yet to be, I mean, the samples whose tests are yet to be, I mean, the reports are yet to arrive, and the bungling in the record system? Is that enough? 1 week
So
time?
uh, 1 week may be very ambitious for several things, but for something simple like rolling out antigen-based tests, 1 week would be perfect time to prepare and then roll out the antigen-based test. The backlogs are very difficult to clear within a week, but at least antigen testing will reduce the current testing burden, thereby leaving the RT-PCR machinery and their entire manpower to take care of those backlogs. Not just that, not just testing, even in terms of getting sure that they are ready now with an app for real-time distribution. So all those things for to be implemented now, I think this is the right time.
Okay. So, Dr. Babu, we are seeing a slight abatement in the surge of cases happening in Delhi and Maharashtra. And we are seeing a sudden surge in the southern states of Karnataka and Telangana. How do you, I mean, how do you explain this? I mean, it was not so high in both the states earlier, when Maharashtra and Delhi were going on a massive upward, I mean, ascending route.
So one of the things that each state and city will have to be reminding themselves of is they can't be immune from a surge in the infection rates. It is bound to happen sooner or later. So the cities and the states which went for surge earlier were the ones where lockdown was not completely successful. So they had import from outside the country. They allowed for local transmission much earlier, and then it was out of control. If you see Karnataka, throughout the lockdown period, the state did really well. There was no local circulation. They could even do reverse contact tracing. So
Till
the
the
moment
influx from
lockdown was
Maharashtra came.
lifted, yeah, so that was the initial phase. And once that happened, there is establishment of local circulation now, and it will go on for some time till a reasonable proportion of the population gets affected. And that's how every country, every state has gone through it. So, except for New Zealand, though, I don't know how long New Zealand can remain without getting infected. So, I don't think any dense setting can remain immune or resist the surge in cases.
So you think the virus is sort of weakening in Maharashtra and Delhi? Is that the reason?
No, virus is same everywhere. It doesn't weaken. It doesn't get stronger. Once it affects a reasonable proportion of the population, we don't know what that reasonable proportion is. People are just looking at zero prevalence surveys, and at most it varies between 5 to 20%. So we really don't know what proportion of the population needs to be infected, after which the decrease in cases and deaths start occurring. So
Okay.
from that scientific perspective, each state, each country has to go through that proportion getting infected, because we don't have vaccine and there's no other way of getting immunity.
Okay. How do you explain Dharavi's performance here? Because certainly I mean, so many cases, it's come down to just two or three cases being reported from Dharavi. Do
I
you think that is
think
called
the
herd
success.
immunity? I mean, is that the right way to describe the situation there?
Even before I say anything about that word or phrase, I must compliment the Maharashtra government in the way they've pulled off this, the real biggest social intervention in Dharavi. I think their success is underreported. Probably this was one of the toughest challenges won anywhere in the world. But if you look at the kind of innovations that they have employed in Dharavi, they are truly unique and unprecedented. So, therefore,
Okay.
uh, more than herd immunity, I would say the success would belong, including reverse quarantine, taking care of the elderly away from the most at risk population. I think Dharavi has tried everything new, like foot operated hand wash machines to um, hydroxychloroquine prophylaxis, and whatever they could think will save them, they have done, and they're successful. I think that's what it shows. When the stakes are so high, the leadership counts a lot, your public health knowledge counts a lot, and how you bring in all the available information in one place and act on it. That's what Dharavi showed. I think that's a fabulous experiment that India did, which should be a role model for any dense settings. If Dharavi can do it, I can't think of any other city saying I can't do it.
Can any of that be implemented in cities like Bangalore and Hyderabad?
Absolutely, absolutely. I think every city should be talking to people who managed Dharavi experiment and then ask them, how did they do it? So, starting from reverse quarantine to whatever they did in that area, everything has to, they've documented a little bit, but more than documentation, we need to learn. If we don't learn, then it's not good, because this pandemic is changing everything so fast in the way we perceive things, in the way we respond things. So if we are not fast in learning, then we'll be consumed by the virus. So better than that, it is better to be proactive.
Yeah, can you very briefly explain to our viewers what exactly did the government do in Dharavi?
So the first thing was what they did was reverse quarantine. So all the elderly and those who are vulnerable, they protected them. Uh, that's a fabulous thing that they did. Next thing is they used chemoprophylaxis, similar to what health workers would do in terms of using hydroxychloroquine. Third thing is, since hand wash and everything was not that greatly implemented, they brought in foot operated hand wash machines, and then they had different stations there. They contacted the local leaders there. They had their WhatsApp groups to share information, which is in terms of ILI, like survey and report, and then how to identify people who are at risk and then address it. In addition to that, they sealed off this entire area and then ensured that no fresh infections come from outside. So, not just that, I have not been able to summarize all of it. I have not done justice. You should be interviewing some public health officer from BMC who will do a better justice in explaining this.
Yeah, because very little is the information has come out of Dharavi in the public domain as such. So my last question, Dr. Babu, is uh, what is the treatment protocol for patients of COVID-19? I mean, are drugs like remdesivir being used or not? Should they be used? Does this latest drug produced by, I mean, approved by the authorities of Biocon drug, is that to be used or not used? At what stage are these medicines to be used?
I think. I wouldn't get into the specific trade names as per se, but then the government of India has issued clinical treatment guidelines, and they've already undergone several revisions. Uh, as a matter of protocol, every institution in this country should be using only the government of India guideline. The reason being, it has been they have been able to do this after considerable consultation with the experts. They have taken most recent evidence into account, and then they have framed these guidelines.
Okay.
Therefore, it is very important that we follow that. We should not be using any speculative treatment. Whatever miracle or mystery cure that people propose, I've been hearing so many things nowadays, but the
I
best
was
thing is
told
to,
that, sorry to interrupt you, I was told that in the case of some of the journalists who were the first ones to test positive in Mumbai, some of them were given, asked to take, consume Chawanprash gold. after
no,
the after the whatever antiviral medicines, they were asked to consume that, and they were given vitamin C tablets. So I mean, that is why this whole question of what is this treatment all about, I mean, that is where this question has come up from.
no, I think there are more experts than patients out there. So everybody, if you see in terms of the social media messages, the list of things to do in terms of therapy, I'm saying, they continue to surprise me, and so I think we shouldn't get into that. And probably some of it stems from fear and panic that there's no treatment, therefore let's try what is known. And when what is known to somebody becomes more important than whether it is safe or not. So I think we should be very careful. This, after all, a virus, but we shouldn't end up doing harm to our body, ourselves, by taking things which are not meant to be taken.
Yeah.
Even before the virus, we might be doing more harm.
Yeah. So the bottom line is that everybody should, go through the basic: wash your hands regularly, wear a mask, and basically improve your hygiene.
So I like to use acronyms here. So I say avoid three C's. Those three C's are close spaces, close contact setting, and crowds. And for me, crowd is anything more than two people is a crowd. And you wouldn't agree, once the Mumbai local opens up, the definition of crowd will not no longer good.
Yeah.
Those are the three C's one has to avoid. The other three W's which everybody has to follow is
Yeah.
wear a mask, wash your hands, and watch your distance. So, in terms of
Okay.
physical distancing, you'll have to be very careful of what is the minimum distance that one has to follow. So, if you do this, I think this is, I would definitely like to borrow the health minister's message here: social vaccine. So, we have got only social vaccine for now till the real vaccine comes.
Okay. Okay. Dr. Giridhar Babu, on that count, thank you very much for joining us. We'll continue to be seeking your perspective on this whole COVID-19 trauma as such. Thank you very much for joining the lead.